Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. Today is going to be very exciting. I've been waiting and anticipating this for a bit. I've got an internet celebrity with us today, and I know a lot of people are thinking the Kardashians. No, we did better than that. I've got with me Dr. Paul Goodman from Dental Nachos. Dr. Goodman, say hello.
Thanks, Max, for having me. Really honored to be here. I always laugh a little bit because people, will see my swag out in the city or somewhere and say, what is Dental Nachos? Say, there's really no real people don't know dentists, but dentists know me. So I don't know if that makes it, the celebrity nesting doll type thing. Yeah.
And I know a lot of our audience is going to know you. So that's why I'm glad to have you here and be able to ask you some questions. But let's just start. I know for those people that know you, I don't think a lot of people know outside of your inner circle. How did you get involved in dentistry? What made you want to become a dentist?
I mean, growing up, I wanted to be a doctor like George Clooney from ER, Tom Cruise from A Few Good Men in the 90s, or a dentist like my dad. My dad, just an amazing friend, dentist, mentor. We worked together until he passed away in 2016. But he never forced me into dentistry. He would just say, it's really great to be your own boss, but do whatever you want to do, Paul. I always was someone who liked to kind of accelerate. I'm a very enthusiastic person. So I went to Villanova to find out about going there, and they had a 7-year dental program. So I said, oh, man, that'd be great. You save a year. You get to do it faster. So I did the 7-year dental program at Villanova and Penn. And I'm really, really glad I became a dentist. Maybe just to give context to me is I probably would have enjoyed to do like 10 different careers. So I don't wake up every day saying I was only born to prep crowns. I do really enjoy dental implants. I do, just honest face, enjoy that. But I'm really glad I became a dentist. But I probably also would have been happy doing those other careers too.
So you do 10 careers right now, and I think that's the truth, right? I mean, you run I think last time I checked, and I'm sure you correct me on this, 36,000, 37,000 plus members.
Yeah, that's about right.
Facebook. Is that right?
Yeah, that's about right. I never knew this would happen. In 2017, my wife and I were sitting at our table. I said, I want to do one of these Facebook groups. Maybe there'll be like 100 people join. What should we call it? And I love Mexican food. I worked in a Mexican restaurant as a server. Love being a restaurant server. It really helped me learn how to talk to people, how to handle challenges. And I said, I'm a dentist. I'm a speaker. Love speaking. I'm a dental practice broker. It's like a lot of toppings. Why don't we call it nachos? And then the metaphor for it really, or the analogy is, nachos are meant to be shared, but they get messy. You share nachos with friends. So that was what I thought the dentistry needed more of, a little more fun, a little more friends.
Yeah, so great job. Thank you. And I know the community appreciates what you do. So let's, with the 37,000 friends that you have on Facebook, or so that you have on Facebook, and speaking, you're all over the place. You know everybody knows you. What are some challenges that you see dentists facing today? And I'll make it a little tougher. Maybe that's not being talked about a lot openly on social media. What are some challenges and problems you see?
I would say the three Ds. Okay, these are the 3 Ds: dental insurance, DSOs, and depression. So dental insurance, DSOs, and depression. I want to also share that I'm not a mental health therapist. I think getting mental health help and working on that is so important. But, you think of periodontal disease for patients, it has all different gradations from, mild, medium, advanced. The dentist will know that. The morale, depression, morale, the morale of dentists and the community, I think, has been really impacted in a negative way by the pandemic. It accelerated, again, some of the challenges that we saw. Dental insurances are paying dentists less for the same care. So I frequently say to my patients, how would you feel if you went to your job and the person who was your boss said, we're going to pay you 22% less next year, but we expect you to work just as hard?
Sure.
And that is what dentists are hearing from the people who are paying them through dental insurance. Now, somebody shouts through their car, you don't have to accept dental insurance. That's true. But dental insurance has contaminated our industry from amazing people like my dad, who said, why don't we sign up for these plans? What's the worst that can happen back in the 80s when maybe the fee that dental insurance paid and the fee you charge patients was like 5 or 10% difference. But I think one of the gap, which I think could swallow up certain practices, between your listed fee and what dental insurance is reimbursing is a real economic challenge for dentists. So dental insurance, the morale of being isolated, I have 2 amazing children. So I'll give you an example. Would you feel like you were really fulfilled, you were really happy if you were hanging out with a bunch of 7 to 17-year-olds all day as a 44-year-old? Would
Sure.
you feel like these are my people? So even though you're with people, or on the other side, you're hanging out with 80-year-olds. Dentists are often the only licensed provider, healthcare practitioner in the practice. So I have an amazing team. I love having margaritas with them, but they can't come in and help me with a filling. They can't, it's illegal. My front desk can't see an emergency. So the isolation, even though you're surrounded by people, is a challenge. And then DSOs are coming into the space and consolidating it just like medicine. And that is causing challenges for practitioners.
Yeah. So a lot of things to uncover there. Let's step back and talk about, being surrounded by 7 to 17-year-olds all day long, right? So I guess it's a good analogy and I understand how you meant it. But how do you change that? So besides jumping on social media, which oftentimes can, it has good purposes, but it can make people feel a little isolated at times, and make them less than, right? Because people usually
for sure.
House. I see a lot of Ferraris on social media, and people are driving Hondas. But how do you cure that? I mean, what are some things that you can do?
ABCs. I love the question, and I love little acronyms, as you know, through Nachos. So ABC to me means so many things. Always be collaborating, always be caring, always be creative, always be connecting. So what I've done, and what I did to my dad's practice, get a partner, was we added specialists, we've added associates. So currently we have 2 locations, and we have 9 dentists that work with us. So I'm role modeling a group of collaboration. You do make less money when you work with more dentists. It's counterintuitive. So practice owners make less income when they have more dentists working for them. But what they have is they have camaraderie, always be camaraderie. They have coverage, another C word, and they can maintain their sanity. So to feel less isolated, my belief is if dentists work together, see, doctors have a lot of challenges, Patrick, but isolation is not one of them. I mean, they're all at the hospital, they're eating lunch together, they're saying, my patient in bed 22 had high blood pressure, what happened with your patient? I worked at a hospital for 3 years as a general practice resident and fellow. So the doctor model of them all being in one place, we wouldn't have enough time if we had 10 podcasts to talk about what's wrong with how medical doctors are paid, but how they're trained and how they interact with each other is phenomenal compared to dentistry.
Sure. Yeah. And let's just actually jump real quick. Let's talk about depression. Depression is something that affects everybody, right? It's not just specifically dentists, but I understand that you're more compassionate about it. What's your take on that? What can people do when they're struggling from depression, and how do they get over that type A personality so many people have, where they're afraid to ask for help?
I mean, perfectionism is a disease. Your patients don't want perfection. I give a lot of lectures, and I have to engage the crowd early. So one of my quick things is I say, hey, everyone here, who's a dentist? Who would like to be happier? Keep your hand up. Who wants to work more hours? And 100 hands go down, and now they're with me, okay? I will also say, who wants, when you go get your haircut, the best haircut possible? They keep their hand up. Do you want your stylist to try as hard as possible on your haircut? And they say yes. I say, is it okay if it takes 7 hours? Keep your hand up. And the all hand goes down. So for dentistry, we were trained in a toxic way that unless this filling is perfect, that nobody sees, something's going to go wrong. Where meanwhile, your own patients would say, get to goodish, right? I say to my associates, get to something that's good. There's only 2 types of dental care, Patrick. There's only 2 types: stuff that people see and stuff that people don't see. So I bring in the expert of composites from the UK to speak to us, Dr. Jason Smithson. He says, when I do a filling in the back, I don't spend 30 extra minutes carving anatomy because my 72-year-old patient doesn't want that. So what I would share is being too hard on yourself, knowing how to get to being done with something. New dentists are such a hard job, being trained by chefs that tell them to make a turkey sandwich in 7 hours, right? It just doesn't work in the real world. So way to battle depressive feelings, right? Camaraderie, clinical acceptability, working on your dental core. And really the key one, I think, Patrick, I've said this a lot because I'm coaching this owner and associate on how to do better together. And the associate was saying this patient didn't want to have the tooth extracted. They want to have a filling instead. And they said, I don't want to do what you have to say. There's a lot of conflict that dentists deal with literally face to face. So training on how to deal with conflict, because I don't know if you've seen the play Hamilton, but it's an awesome play. People pay a lot of money to see it. Being a dentist, opposite of that. It's a Broadway play nobody wants to see or pay for. So if you don't understand that when you walk into your office, it can be very demoralizing. That was really the D. Depression, of course, is something that a mental health therapist diagnoses and helps you with. Demoralizing is kind of more of this evergreen term to how you can sometimes feel in your office each day.
Yeah, and you're right. You said it yesterday. I've heard so many people say it that, they flat out say it to you. Say, I can't think of one other profession where the customer comes in and says, hey, I'm here for my appointment, and I hate seeing you.
Yeah, right, I know. I just keep it in your head. Why do you say that, right? I say to my patients, you're like, you don't have to tell me that.
Yeah, but let's isolate that, right? There's a few other professions that I think people generally hate. If you ever had to, work with lawyers in any type of litigation, you probably hate lawyers, right?
Yeah.
Right. I mean, you take that on, and clearly no one really means it, but when you hear it all day long, it can affect you. Give me some tips to deal with that exactly. How does a dentist get over that? What are some tips and tricks that they can use to kind of some Jedi magic to get over that?
I try to disarm with humor all the time, right? All the time. So one of the things I do now with doing less being at my office is I do a lot of consults for large cases on brand new patients who need a lot of work. Very hard job. Because you got to walk in, you look at an x-ray and you go, this person needs all their teeth removed and is going to have to spend $40,000. It's not an easy conversation, right? So I disarm with humor and I say, oh, a lot of people say that, right? A lot of people say they don't like the dentist. A lot of people say they hate the dentist, right? And I go this, I'm like, Patrick, do you like eating? And you go, yeah. I go, well, we're just trying to help you do that. I think you should like us better. Sure. And they smile because I disarm them. I don't make them feel less than for saying it, but I kind of highlight they're a little bit nacho nuts for telling the person who helps them chew that they hate them.
Yep. I'll tell you something. I'm going to share this because I'm going to share the personal story that, and I'm going to do it because it's going to be a huge audience for us. Thank you for doing that. Appreciate it. But I didn't grow up with probably the best level of care, and going to the dentist, brushing your teeth was something that nobody in my house ever told you to do. It's my house. I have to beg my kids to brush their teeth, and I have to actually force them to do it, right? Physically stand over them. And so I had dental issues when I was younger, and then turned out to have a okay level of success in my life where I could certainly afford dental care, but I didn't really think too much about it until I saw this thing on the internet on an old Gateway monitor, right? The old big box monitors, how long ago it was. And it was an Oprah Winfrey test to find out your real age. And I took this, and one of the questions, you ask all these questions. How many times do you exercise? What do you eat? What do you do? When do you sleep? All these things. What do you do for work? And I answered it. One question was like, do you floss every day? And I answered it, no. Told the truth. And, it gave me what my real age was compared to my actual age, quote, real age. I went back and checked that box, and it added 2 years to my life.
Wow. Yeah.
And clearly this is an online quiz, right? Take it for what it is. But then I thought, is it because flossing your teeth really makes you healthier, or is it that just really healthy people floss the teeth?
It's probably more of the second one.
Yeah.
But, that's such a good story. And, there's been this thing about the link between periodontal disease, gum disease, and heart disease.
Yeah.
Some dentists have grabbed onto this in a way that I think they believe, but they sometimes can scare their patients. Other dentists think it's kooky talk. I'm right in the middle from your test. When someone comes in, what dentists are seeing is a cross section of the public who do go to the dentist, right? So you have to have certain means to go to the dentist. When people say, we need more dentists because there's so many people who don't see a dentist, I say we need to solve the access to their care first before getting more dentists. But if they come in and I see somebody who has 80% bone loss, doesn't take care of their teeth, even if they're financially successful, they are not ever paired with optimal health, right? And I'm not saying that the periodontal disease causes it. I think it's what you said. It's a habit that people do when they're healthy.
Yeah. Yeah. And I'll tell you, there is, and I know this, there's from just experience, there are groups of people who have the means now, can spend whatever they want on their teeth. You couldn't, they could write a blank check that you couldn't spend on their mouth, but they're not going to the dentist because they're embarrassed, because they face shame and that sort of thing, right? And certainly turning that around. You can make people love it. I love going to the dentist now.
Yeah.
Absolutely. I take every treatment that I'm told to take.
What's funny about it is when I have a new dental assistant and I have them work with me and I do some quick videos with them and I go, oh, you never worked with me before. I know I'm a bit kooky. What do I do that's different than any other dentist that you've done? They say, you kind of make it like it's fun in this room, and you make it feel like you're talking to a friend. So that's my best message to your audience. When you're in an operatory with a person, make it feel as fun as possible, as funny as possible, and like you're talking to a friend. Because I think if you do that, you will bring people's armor, their armor down, and let them be open to learning from you.
Yeah, I'm gonna ask you one question. You're a guru. There's a lot of legitimate gurus out of there. There's a lot of people that are just looking to make a buck, right? That exist all over the place in the dental industry. Tell me, when you're trying to find someone to help you with these things, you're trying to help navigate insurance, you're trying to work on your own mental health within inside of your profession. You're trying to make a living. You're trying to raise your hand and be happy. How do you find someone to help you? What's a good way to vet?
It's a really awesome question. And it's a question that we hope be helpful to dentists, because I believe that their inability to get help being worried about being taken advantage of limits their life, right? So what I would say is the story is the star. Ask people who do stuff. Like, I'm a transitions broker. You said, hey, Paul, I want you to sell my practice, but I'm not sure if I trust you. This is what you ask. Could you tell me a story of a recent client that you work with and how that outcome was? And then follow up with, when things go off script, could you tell me how you get them back on script? So let's just say you asked me this about dentistry for a big implant case. I say, awesome. One of my favorite patients, Millie, just did the snap in and out overdentures. And she was just like you, Patrick, not sure if she wanted to spend the money and the time. And here's a video of her happy. But then there was this other patient, Mark, true story, who we did a stay in all the time implant case. And after 10 years, some of those implants need to be replaced. And things have gone off script, but we got Mark back on track. So it's people's confidence with stories of people they've helped, coupled with, ask some people too, like use reviews and then that too. So ask for stories from the person and then top that with some referrals and reviews.
Yeah, makes sense to me. Dr. Goodman, I want to just promote a couple real quickly. Your practice website, your main website is penningtondental.com, correct?
PenningtonDentalCenter.com, PenningtonDentalCenter.com.
Check that out. I want our audience definitely check out dentalnachos.com. Terrific, great content on there. You can learn a lot. And then, of course, check out the Facebook group. If you search Facebook, dentalnachos.com, you're going to find it. And by the way, you're at 38,800.
Yeah, right. We're moving on. Maybe after this, we have 40,000. Maybe Mark Zuckerberg will give me a prize. I've got no prizes so far, but I'm holding out for a prize.
It's awesome. Thank you so much, Dr. Goodman. We appreciate you.
Thanks for having me.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.